Hi there everybody, and welcome to today's live stream. We are going to be talking a little bit about how we treat lower back pain in the clinic today. The purpose of this video or today's live stream is to give you guys a bit of an understanding about what we actually do in the clinic, and if you're one of the members to the Back membership site, give you that extra insight into how the therapies that we use in the clinic actually are reflected in part in the specific exercises that you're doing in those early stages in the Back and Shape membership site. So it should be really interesting and give those of you who don't have direct experience with us in the clinic a little bit more insight into what we do, why we do it, and how it works and how it relates to the rehabilitation that we get patients to do outside of the clinic. And remember, you've got any questions during this live stream, that you can always stick those in the comment section underneath, and Lara will read those out at the end of the live stream. And I hope you guys find this super helpful, super insightful, and ask lots of questions at the end. It should be good fun. So if we get into it, first and foremost, how we treat lower back pain. So in today's live stream, I'm going to talk about just the fundamentals of how back pain works, because this is really, really important in understanding that, because that's the framework that we use when we're choosing what therapies that have gone into the clinic to treat back pain effectively. And then we'll talk about our treatment approach and how it addresses each one of those sort of four main components of back pain, and then how they work in the clinic, how the treatments actually work themselves, and then drawing out those similarities between the treatments that we do in the clinic and the rehab stuff that you guys have to do at home, and how three of them really are replicated at home in part, or the best way you can to be as effective as possible. And that's why the protocols that you guys are doing in the Back and Shape membership site are often quite different from any back pain rehabilitation that you've had or been given in the past from the likes of the NHS and those sorts of outlets. Very, very different in fundamental ways. And hopefully by the end of this video you'll really understand that, and then you guys can ask any questions at the end. So if we get into the fundamentals of back pain, I'll just get the spine out again. It's a little bit of revision work, but repetition is the father of learning, I think is the phrase. So we'll go through it again anyway. So what is a back injury? A back injury, the main role of this structure here, the lumbar spine, is to resist the load of gravity and then allow you to move around and do things. And when it fails, it generally fails because the compressive load of gravity either has occurred in one go, that compressive load has been so extreme that you haven't been able to manage, and that's a severe accident. That might be a car accident or a severe fall, or something. I had one guy who was using a harness in a heavy lifting sort of machine manufacturing plant, and the machine broke and all of the load then went through him and led to his back pain. So it can be a one-off occurrence, but that is very, very rare. More commonly, it's the repetitive compression through the spine that leads to these structures failing, and that's when we get an injury. So the injury is the number one, and the compressive load is what has caused the injury. And then in association with that, we often get perhaps that load was going through one joint, maybe the L5S1 or the L45 down here, so much more because some of the other joints were stiff and rigid, and maybe they've become rigid after the injury and they're not allowing it to recover as well. So we have a degree of rigidity in the spine, maybe in the hips as well, and then there's always going to be some muscle spasm associated with that because the muscles are reactive. They're never a primary injury when we're talking about back pain. They're always going to be reacting to something that has become injured, unless you've got a specific muscle tear, in which case it's often very, very obvious that that is the problem, bruising, etc. So those are the sort of the four main components that will go wrong in the back, and they tend to go wrong together. It's very unlikely that you're going to have one without the other. You can't get an injury without muscle spasm and joint stiffness around a structure as the muscles try and brace that area and stiffen the joints up. And generally speaking, the spine's main role is load bearing, so you're not going to get a massive stretch. I use the example of a parachute accident. Perhaps your parachute got caught, in a tree, and you suddenly got stretched, and that might be the only scenario that I can think of off the top of my head where you might actually get a stretch injury, which would be different. And obviously we need to bear that in mind. So that's how the injuries actually work. Now, getting into our treatment approach to address these, you can see I've used the little icons. You might recognize these on this side. On our website, when we talk about, this is at themayfairclinic.com, when we talk about the therapies, we've got vibration therapy. You can actually see the guns over my head here. We use the hypervolts in the clinic. They are awesome, really, really good devices, and a lot of patients, or a good number of them, actually get those to use at home as well. I've got them at home here because I use them after doing runs and things, and after the gym under normal circumstances when the gym's open. So they're fantastic tools to work on the muscles. We've got the spinal adjusting instrument, we've got the IDD therapy, which is spinal decompression, and then we've got the laser. Now, if we go through these each one at a time, what do they actually do? Well, we said there was going to be muscle spasm when we injure the lower back. And we use the vibration therapy first and foremost to work on those muscles in a way that's very, very effective and very easy for the patient. You can stay completely still, either lying on the bench or even standing up. Sometimes patients can't sit down or can't get on the bench, they're so bad. And we use the vibration as a means of actually working on those muscles in the short term, maybe that first 1 or 2 sessions, when the patient can't even move. They're very, very in a lot of discomfort. And the vibration has 2 benefits. One, it allows you to work in that plane without the patient actually doing anything. Unlike massage, which rubs the person around, etc., vibration is very different and can be done with the person still. It's not painful to have done at all. Yes, you can press into certain spots for certain people, but generally the main approach to using the vibration is very, very comfortable and rather pleasant for the overwhelming majority of people. It increases blood flow, breaks down scar tissue, helps the muscles fundamentally work better generally, and that's why we choose to use that. The other quirky little benefit is that vibration is transmitted if we think of our neural system, our nervous system, it transmits information in lanes, and pain is transmitted in one lane alongside pressure, which is a fundamental tenet when you're doing massage. You're applying pressure, you're stimulating a certain pathway, a certain neural pathway. Vibration actually runs in a different lane, and therefore quite often you find patients that have a lot of pain, neurogenic pain, those sorts of things. When you do vibration on certain areas, it actually completely eliminates the pain while you're doing the vibration, so it can be quite relieving at the time as well. Now, it's important to note that vibration is not a long-term fix, but it's an integral part of this system that is worthwhile in its own right. Then we get onto the spinal adjusting, and I'll get the spine up for here because we use this when we have stiff joints. So we mentioned the muscles get tight, and we've got stiff joints that don't work so well, so we can use that to come onto these specific joints. And it might be, as is commonly the case with lower back issues, especially disc related problems, that we have a flatter than normal lumbar spine, and we can use the adjusting instrument to actually get a little bit of curve back into that lumbar spine when we're doing the adjustment, and then followed up with other protocols that we do, we can actually make a change in that curve in the person for good. But that spinal adjusting instrument is a very painless way to start to get these joints moving. You can adjust the power and the frequency, etc., of the device, and is much, much more pleasant for a patient than traditional manipulations. And manipulations can't really be done in one plane, i.e. you can't do a manipulation into extension. You have to use other levers, and that breeds issues that we won't get into now, but maybe can get into on another live stream specifically about spinal manipulation. Then we've got the spinal decompression. So to recap, we've done work on the muscles with the vibrations, we've got stiff joints moving a little bit better with the adjusting instrument, and then we use the decompression. And the decompression, or the IDD table, is an awesome table. You kind of stand on it first, and then the whole thing lowers you down into position, so very comfortable for patients that can't get on and off a bed. Really, really good. And that's working really for these discs and really decompressing this section of spine, taking the load off the discs, and then creating this lovely pumping effect. And it is fantastic. If you've got any sort of sciatic nerve pain, and obviously you can do this on the neck as well, similar symptoms and similar phenomenon occur when you do that decompression and take the pressure off those discs. It's really relieving. Sometimes you can actually get that pain in the leg completely retracting during the decompression treatment. So it is really fantastic one to undo the load of gravity on that patient and actually give that area, that injured area, a bit of time to actually go through that healing process and get some exchange of valuable nutrients as well. And then we finish up with the laser. The laser is really very, very good because it doesn't matter what's wrong with you. It doesn't matter how sore and acute, difficult to move it is. As long as you can get to the clinic, we can do laser with you. There are a few contraindications. Of course, we wouldn't want to shine it in someone's eye, those sorts of things, but if you're doing that, well, that's just silly, so don't do that. But the laser is incredibly safe, and we can direct it straight over the tissue here. It'll go about 6 centimeters maximum into the tissues, so it's really, really good at actually getting some targeted healing into the section that we're working on, and that allows us to focus on the injured disc, the injured structure in that lower back, and help speed up that tissue healing. You get increased perfusion of oxygen, increased circulation. You get a process called angiogenesis as well. And I'd recommend, if you're interested in the laser, read more about it on the mayfairclinic.com. There's under the treatment section. But increased angiogenesis, which is the growth of new capillaries, and a number of other awesome benefits to just improve the quality of the healing in that area. Now, that's kind of the approach. We've got the vibration where we're working on the muscles in the lower back problem. We've got loosening off stiff joints with the joint adjusting, and then we've got the decompression to take the load off your spine, and then finally we've got the laser to speed up that healing process, and all that works together synergistically. This was something that we actually coined, I think it was back in 2018 when we were in the Daily Telegraph, which was awesome for us, and we coined the term the Mayfair method, which is this approach for patients with back pain or neck pain, putting these therapies together as a means of helping someone. And the question is, do I need all four? Yes, you do, because they each bring a different benefit to you as a patient with a back problem. So they're fantastic, and that it's the Mayfair method that's also been there in using that technology, which is what's won us the Queen's Award this month. If you haven't already heard of that, we've been talking about it enough the last 24 hours. So it's that use of technology that's won us that award as well. So it is a really innovative approach. It's very, very thorough. No one else is really doing anything like this in terms of so condensed and adding in all these extra non-invasive therapies together for the patient. So it's a really awesome thing. Now, how does that relate to you if you're a member of the back in shape area? Well, I'm going to go through that right now, because why do we want to get the muscles working? Well, we want to work to free off some of those muscles so these hips work better. Okay, so the hips can work better to take pressure off the lower back, as we've mentioned in the past. Well, we do vibration in the clinic, and you're doing your hip stretching. So you're stretching those hips to improve the quality of those hip muscles, the flexors, the extensors in the hamstrings, and the glutes as well, to increase the mobility in those muscles so they're not putting as much strain on the back. We generally advise you should not be taking excessive bed rest. You should be moving around, little bits of walking. As we're walking, these small undulations that go through the spine keep the joints moving as well as possible. Avoiding those sedentary positions keeps the joints mobile, and that's your way of doing the joint adjusting. Now, it's important to bear in mind this is nowhere near as effective as when we do it in the clinic, but the principles there of keeping the muscles in good condition and free from spasm, nice and flexible, keeping the joints moving are true in these activities that we get you guys to do at home. And then finally, we've got the decompression, which is the towel exercise that you guys do at home, which actually unloads these discs and takes pressure off the discs. So those three things are mirrored in the way in which we ask you guys to look after yourself in those early stages of back pain when you're doing the phase 1 protocols in the membership site. And those three things together, coupled with using the icing, help create a healing environment for your body, help your body heal better, which is the laser. Yes, it's not going to do the same thing that the laser does, but the principles are all there in the rehab protocol, and that is why we've put it together. It mimics in ways the treatments that we do in the clinic, and with the focus that we have in the clinic, and that's really what's gone into the Back in Shape membership site and the protocols that you do. And then the same as patients in the clinic that are getting treatment with us, you will then move on to do strengthening based exercises to build up support for the skeleton and the support for those injured structures and the lower back, to really enhance that healing process and protect it for the medium to long term. And that is pretty much what we do. I'll recap it one more time for you guys, just in overview. If we jump back to this one here. So how back pain works. Back pain is that compression through the spine. It leads to an injury, either one-off or over a period of time. We get muscle spasm and joint stiffness, and we get a problem that's not healing as well as it should do. In the clinic, we use the therapies, the vibration, to decrease some of the muscle spasm. We use the joint adjusting to get these spinal joints moving better so that the whole thing works as a unit in unison rather than pockets of immobility. We use the spinal decompression, the IDD therapy, to unload the gravity, take the pressure off those injured structures, and we use laser together with that process to enhance that healing process and speed it up as much as possible. And then how does that translate again back to you in your in our Back in Shape membership site? The phase 1 work is there, and it's there for everyone to use. We've made it as accessible as we possibly could to people. We've got the work on the muscles to improve the mobility. We've got the core work to provide a bit of stability, which is separate. But we've got the advice of you do need to keep a little bit mobile. You don't want to just be camping out in the bedroom or lying down all day. We want to keep a bit mobile. We've got the spinal decompression exercise where we're lying over that rolled up towel to unload the discs, and then we're using the icing. And these three things, the three aforementioned things to really enhance and allow your body the best possible opportunities to heal as well as it possibly can. So I hope you guys have found that insight in today's video into how we work in the clinic and how that relates to the exercises you might be doing in the Back in Shape membership area. Hope it's been interesting, and if we've got any questions, we'll go through those now.
Just one quick question. The harnesses that you see advertised on Instagram and Facebook, that
for the neck,
door ones for the neck, that's a type of decompression. Would you recommend using those?
No.
Okay.
I'll explain why. Look at the position that you are in that position. You're in a position where you're on your back like so. The neck should be in that position there. If you look at those, the head is actually hanging off the ground. So we're actually in that position. Now, the tendency is going to be that when you're in that position with your head hanging off the ground in that position, you've got that forward head posture. That's not optimal. And if you're doing it and it feels nice, which it probably will, because it will have a bit of decompression to it, but if you're there still for 20 minutes, half an hour, 40 minutes every day, that's going to cause a degree of ligament remodeling in the neck, and you might end up with more of a forward head carriage than you otherwise had beforehand. So I'd be very cautious about those. Not to mention the fact that if you live in a house with other people, the chances of someone opening that door is a risk I really wouldn't want to run. When you are in a position like that for a long period of time, the ligaments will be changing. Anyone that has done the Denerol in the clinic to change their cervical alignment will know this. You are a little bit vulnerable as soon as you finish the exercise, and when you get off, you have to be careful. Imagine someone, opening the door by accident or something like that. God knows that would be terrible. So I'd be very cautious about those sorts of activities. And the same thing for neck braces. They don't work, or they're problematic in numerous ways, and they may be necessary at certain times, but that needs to be explored for your own personal case. And then obviously the hanging your head over the door frame as well, those ones, I'd steer clear of those personally.
Another question, can treatment give you long-term relief, or would you be reliant on treatment?
So can treatment give you long-term relief? The fundamental role of the treatment is there to heal, is to help your body heal effectively. Once you're healed, the thing's healed. Now, can you re-injure yourself? Yeah, of course you can. The same way you can get a cold again. So the treatment is there to help you. Now, the treatment is not just done on its own. In this video, we've spoken a lot about the treatment itself, but there's the education, there's all these other sorts of things. If you're not going to pay attention to the way we use our body on a daily basis, understand the things that have led up to this being a problem, maybe there's some spinal alignment issues that we can work on to remodel. Then once we've done all that, if you continue to keep your body strong, doing the right necessary exercises, then any additional treatment would be a luxury, the same way some people go for massage, but you wouldn't be reliant on the treatment as long as you've been through the treatment process, engaged with all the things that you've been doing prior to that were problematic, and made significant progress in terms of strengthening up the supporting structures for your spine with consistent rehabilitation. That particular problem will have been dealt with, and then any subsequent treatment is just a luxury. For example, under normal circumstances, I'll jump on the decompression table about 2 times a week because I'm doing lots of things. It's nice. It's looking after yourself. The same way, we brush our teeth every day and do other sorts of things. It's a luxury rather than a necessity. Any other questions?
That's all the questions for today. But if anybody is interested in getting some treatment and they want to kind of read up on what we do, they can always go to Google reviews and have a look at it. Yeah.
So if you guys do have any questions about the treatments that we do, you can head over to the website, themayfairclinic.com. You can also check out our Google reviews on Google. Just type in themayfairclinic.com into Google and it'll come up with the business page, and you can read more about it there as well. And if you've got any direct questions about what we do in the clinic as well, or how it relates to the membership site, then please do bang those in the comments below, and we will get back to you guys and maybe even use it for the next live stream. So thanks a lot for watching. Have a great afternoon, and we will see you tomorrow with another live stream.
Thanks so much.